typically if I'm going to do a total freeze, the patient will not have any erections. So I think with that, it's time to come back here to the ultrasound image so you can see exactly how we're planning things out based on that model, the 3D model that you just saw. So we're back here with this image, and this is where we believe the 5 probes should go. We have 3 over on the right side, 2 over on the left side, and again, we can even change the location of these probes. Let's move probe 2 over towards the midline a little bit. So we're going to go more high and inside, maybe up a little bit. Probe 4, let's move up a little bit, maybe over towards that, yeah. And then probe, that looks pretty good right there. So now we're going to ask the machine to calculate the distance between the probes to probes. We typically do not want a distance greater than 2 centimeters. It's common to have the distance here greater than 2 centimeters between probe 5, which is down in a lower left-hand corner, and probe 4 because we're doing the focal. But other places we want to try to minimize this distance. Let's try to pull 1 and 2 closer together. Okay. Maybe, yeah, there, that's good right there. And then maybe probe 2 over just a little bit too towards the midline. That looks good there. Okay, so that looks good. And then after this, what we're going to do is we're going to measure the distance from the probe to the urethra. We don't want anything closer than 0.5 centimeters. Anything closer than that, we're at risk of freezing some of the urethra. Maybe move 3 over towards the midline a little bit. Yeah, right there. Okay. Now let's do probe to capsule. Probe to capsule, again, we don't want anything as close as 0.5 because we're going to have most of the ice outside of the prostate than inside of the prostate. But looking at this here, everything here looks good. How's number 3 looking there? Okay, so all this probes looks fine. So again, once we have this pre-treatment planning, we're going to map out exactly where the probes are, the distance between probe to probe, the distance between the probe to urethra, and the distance between the probe to the capsule. So with this, we're good to go to start putting some of our probes in. So I'm going to start putting probe 1 in here now.